we mentioned genetic polymorphisms, and certainly the polymorphisms in some P450 isoforms, such as 2D6, 2C9, and 2C19 are quite prevalent. This leads to poor metabolizer phenotypes and substantial subpopulations, particularly within certain ethnic groups. And that phenotype can lead to significant increases in exposure to the drugs in those poor metabolizers. And so this is something we would want to identify early on, the potential for that. And what we have here is what we call our Witch P450 model. So this identifies the specific isoforms that are most likely to be responsible for metabolism of a compound. You can see it's sort of represented here as a sort of pie chart. This is looking at the relative likelihood of metabolism by different isoforms. Again, it's not a prediction of the relative rate. We've talked about predicting rate a moment ago. So this is looking at how likely a given compound is to be metabolized by each of these isoforms. And in examples like the one you can see on the right-hand side, which is metoprolol, if you see a prediction that the metabolism is predominantly by a single polymorphic isoform, this would indicate an increased risk of exhibiting differences in exposure due to the polymorphisms in this case, CYP2D6. Now, what one would want to do in response to a prediction like this, of course, is to experimentally verify this. So we might use something like a P450 phenotyping experiment using recombinant enzymes to really dissect which of those isoforms are likely to be responsible for clearance of that compound.